Welcome back. Nationwide, COVID-19 is impacting communities of color. Here in Utah, Pacific Islanders, people of Hawaiian, Tonga, Samoan, Marshallese, and Fijian descent have the second highest infection rate in the state.
Several hotspots have popped up this summer. The biggest one is in Salt Lake County, where Pacific Islanders now have the highest rate of COVID infection. 2 News went looking to find out why and how this tight-knit community might be fighting back now.
When I was lying downstairs and just in so much pain and just so miserable.
Loisa Alvua'a Tupo contracted COVID in early June. Then her husband got it, and then her mother.
How are our Pacific Islander matua, or our parents and our grandparents, going to fight this virus off when it's been so difficult for me and I'm 31?
Now this mother of 2 is providing outreach through the Utah Pacific Islander Public Health Coalition because COVID-19 is ravaging her community.
We're being affected largely because of the way our cultural practices are ingrained in who we are and how we gather.
Community leaders told 2 News that in Pacific Islanders culture, family not only comes first, families are bigger and often include multiple generations in one home.
The family unit is definitely defined very differently, and it's caused for misunderstanding when we're talking about isolating out away from society. They think it's their family of the 70 of them.
Many of Utah's Pacific Islanders are deeply religious. If houses of worship have services, they'll be there.
Deeply rooted in our culture is to gather.
Louisa says weddings and funerals are still happening.
That it's been so difficult, and it shows in the numbers of Pacific Islanders that have been affected.
The figures from the Utah Department of Health are alarming. Pacific Islanders make up less than 2% of Utah's population, but they have almost 4% of COVID cases, 150 hospitalizations, and 13 deaths. Now a new hotspot is growing rapidly in Salt Lake County. These 15 communities have the highest numbers of Pacific Islanders in the county. And this is where COVID cases are running rampant, putting these communities at greater risk. West Valley City Council member Jake Fitzemanu says the county and state data is not specific enough. Which religious communities are being impacted? Which industries are people working in? Those questions are not being answered.
The governor has been doing lives since the beginning of this pandemic, but it wasn't until our community leaders started doing lives on Facebook that people started to pay attention.
Oretta Tupola, director of the Utah County Pacific Island Health Coalition, says news spreads through word of mouth.
We call it coconut wireless.
From relative to relative, and then out into the state's network of Pacific Islanders.
The communication and the discussions and the spread of that news really comes from the trusted members in your community or your family, and then it spreads out in that way.
Aloha. It's not easy.
Community health workers and leaders are putting out public service announcements in multiple languages, assembling and distributing care kits, and staying on site at mobile testing units. They're trying to get the word out to Pacific Islanders everywhere. COVID is spreading, and the consequences can be serious.
Even though there's an urgency to address this pandemic, I think we're right on time with where we are as a community, because it's been a hard transition. And so first in building trust, and then letting them know that we are just here to help.
Salt Lake County is trying to address the challenge of keeping family members safe when they live in intergenerational homes. With a referral from a community health worker, people who do test COVID positive can get a hotel voucher and 2 weeks of meals.